So I'll just briefly explain how today's webinar will go. And before that, I'm probably some of you have not met me before. I know some of you have. So in case you haven't met me before, I'm Dr. Shabnam Das Kar. I'm a functional medicine doctor and a certified tiny habits coach. And I live in Alberta in Canada now. I'm originally from India. So for many years, I was an OBGY in India, taking care of patients with PCOS. But back then, there was a lot that I did not know about PCOS. For example, one of the biggest areas which when I got to know it, I felt really ignorant, was the issues of, anxiety and depression and all the mood issues that came with PCOS. Now we know that those are a feature of the condition, but back then, of course, the only thing when I was an OBGY I used to use was birth control pills to regularize their cycles. And then if they were looking for fertility, then I would send them, do some initial workup, and start off with some initial, ovulation induction, and then send them off to my colleagues who were specialized in fertility. Versus, there was not a lot of, lifestyle change and things like that. We tell a lot of people, and many people with PCOS are living with obesity. And I used to, again, send them off to this was my hospitalist days. I send them off to a dietitian in our hospital, and, you just come up with a plan and lose some weight, but not a serious long-term plan. Fast forward few more years, I got interested in time-restricted eating, intermittent fasting. So I decided, oh, I need to, help women with this using time-restricted eating, intermittent fasting, low carbohydrate food, because now I'm educated in nutritional medicine. But one of the missing pieces, and I know some of those people who were on my earlier programs. So this was about 2 years ago, or maybe even longer. You know that we had a series of 8 weekly webinars. Me and my associate Mikhail we used to do, but all those programs, of course, when you are on a program, you're highly motivated, you're excited, you get great results. But what happens, 6 months down the line? And I used to get these emails from my patients saying, Doctor, I did so well when I started off with you. I lost weight. My mood was better. I didn't have anxiety anymore. But now, after all these, 6 months, then COVID hit, a lot of stress. I started working from home. I couldn't work out. And I seem to be getting back to where I was before I started on the program. And I thought, oh, this is not really solving. I have not helped you solve your problem long term. Then again, fast forward a few more, some more months, I got trained as a tiny habits coach. So I'll talk about that as well today. So how today's webinar will go. First, of course, I'm going to talk about what are some of the things that probably get in your way when you make lifestyle changes. I'm sure all of you have had this experience, as have I, that you're very excited, you start on a program, you eat a different way, you start exercising more or prioritizing sleep. And then what happens after some time? And I will give more examples in relation to weight loss, because that is one of the major challenges for women with PCOS. And one of the biggest challenges with weight loss itself is you will lose weight on any program. You eat a low calorie diet or a lower carbohydrate diet, or, as my friend calls it, the cabbage soup diet, or you use meal replacements. So in the world of, weight loss, one of the biggest challenges is in maintaining the weight loss. See, acute weight loss, I'm sure all of you have gone through this experience, and you can, if you feel that you'd like to share it, you can please feel free to share it. But maintaining that weight loss has been a struggle for a lot of people. Sometimes, a lot of that weight comes back. You might have been on, a medication as well, like the new medication semaglutide, but you lose a lot of weight. The biggest challenge comes in the maintenance phase, and I'm going to talk a little bit about that as well. Then I am excited to relaunch my free course, So I've named it now PCOS Clarity. It's a lifestyle approach. Now, how many of you are confused by all the information you get to know about PCOS? Eat this, take this supplement, it's a magic and it works for PCOS. Eat this particular PCOS diet. PCOS diet has a lot of people, talking about it, but is there really a specific PCOS diet? So all those things, I realized that people are confused with a lot of the information. So the free course PCOS Clarity, I'm going to relaunch today. And I'm also going to launch a lifestyle program, which I am very proud of. It's called Living with PCOS, the Tiny Habits Way. So this is going to be the initial launch of it, and you'll get access to all of them. You'll get access to the free course. You'll have access to the paid course as well. So this is how I plan to follow, and I do intend to have time for questions at the end if you have. So here, first, I'm going to start off with what are the things that get in your way in relation to your PCOS and in relation to making lifestyle changes in general. One more thing I wanted to highlight is PCOS is different for different people. For example, if you are a young person in your 20s or early 30s, or even younger, actually, a lot of adolescent girls have PCOS. You may not be concerned, you may not be concerned about, fertility. Like, not a lot of 18-year-olds are thinking about fertility. But then let us say you're a woman who's about 30 or 35 years old and you want to start a family. Then fertility becomes a bigger, becomes more important for you. Whereas cycle regulation may be important for, many people. Then, as you know, so PCOS journey it's a lifelong condition, and I'm surprised to know that a lot of people are not told by their doctors that this is not like an acute infection. It's not like you get a flu and after some time you're fine and it's gone. So PCOS is a whole life. To manage PCOS is a whole life thing. So younger years, you may have more of, cycle irregularities, excessive hair growth in places you don't want them to grow, living with excess body weight, fertility issues, mood issues. Mood issues are a big thing for a lot of women. But as you grow older, so even in the women who are, menopausal, perimenopausal, PCOS still has an impact. And I'm not going a lot into the, the science, because if you are here today, you're definitely interested in PCOS and you probably already know it. How the underlying problem in PCOS is insulin resistance. So basically, your body's, insulin glucose metabolism is affected. And all those symptoms come up from that, essentially, whether you're looking at mood issues or the high androgen levels. So androgen are the male hormones. So all the features of PCOS, high androgens, irregular cycles, fertility problems, anxiety, depression, all of them are related to the underlying problem. So basically, it's not just a problem of the ovaries, it's a problem of the whole body. And the other aspect is some people do not have the problem of obesity, though it is very common in many parts of the world. So they are called the lean PCOS, and sometimes that itself may be a challenge in the diagnosis. Then, of course, the diagnostic criteria, I'm sure all of you are familiar with that. But what I want to highlight is in younger women and younger girls in the adolescents, polycystic ovaries on ultrasound may be present even without PCOS, but the underlying problem, which is not addressed quite often, is the insulin resistance. The insulin resistance, which makes you pushes you to a higher risk for heart disease, stroke, hypertension, diabetes, pregnancy diabetes, and dementia down the line. So those are things that people will say, oh, you can't put a 15-year-old on medications for her whole life. Yeah, but that is where lifestyle changes come in. So I'm going to start sharing my slide again. And yes, you will receive a recording of this one. Okay, so what gets in your way? That's a huddle. So this was something I didn't know until fairly recently. So I have to thank Dr. Vera Tarman for making me aware about this. Sorry, I'm looking distracted because I'm trying to get all these little notifications out of my screen. So one of the things that I'm aware of it now, but I'm not a specialist in treating this, is your relationship with food. And Dr. Vera Tarman has, she's written a book a few years ago. She talks about food addiction. So what do I mean by relationship with food and food addiction? So how many of us, and that includes me, how many of us eat when we are hungry? The only reason we eat is we are very hungry, and we eat food that are extremely nourishing. We don't crave, the sugary stuff, the cookies and the cakes and I don't know, you can name them. I have not been eating them for a while. So burgers, pizzas, and it's so easy to order any of those nowadays from anywhere in the world. Just a few clicks on a phone app, and you have all this food reaching your front door. So relationship with food is very important. And in fact, the first lesson in the PCOS Clarity course is figure out whether you have food addiction. Now, when it comes to food, relationship with food, are you using food to soothe your, to calm yourself, to soothe your nerves, so to say? Do you eat food outside your plan? Because I am 100% sure all of you know that, eating sugary food, ice creams and cookies and pasta and pizza is not good for you. But despite knowing that, why is it that you struggle with it? So if you have a relationship with food that is not helpful to you, I don't like to use a lot of negative terms, so I'll say unhelpful relationship with food. Unless you address that, no magic PCOS diet is going to, help you long term. Short term, yes, when you're highly motivated, you can do a lot of wonderful things. And I'll tell you how to use your high motivation. That is what I'm going to do in my course, Living with PCOS the Tiny Habits Way. So first of all, figure out what your relationship with food is. And this is something I didn't know about earlier. And more importantly, I didn't know about the importance of it. Yes, of course, I knew, we eat for all sorts of reasons. We eat because it's a festival. We eat because it's in front of us. So food environment, and each of these things need different strategies. For example, food addiction, you will know, the screening, Yale Food Addiction Questionnaire is in the course, PCOS Clarity. If you have food addiction, it needs a specialist, to help you with that, because food addiction is not like eating disorders. So eating disorders are conditions like, anorexia nervosa, bulimia. Those need specialist treatment as well. So if you haven't taken care of those conditions and you're just, jumping into a new plan, a new PCOS diet, and then after some time you find that that is not working for you anymore, maybe what you need to start with is your relationship with food. What makes you go eat out of plan? Like, I know I ask this to many of my patients. So do you snack because you're hungry, or do you snack because it's a habit, or do you snack when you're bored, or do you snack when you feel like you're very busy, you have no time to cook? And so it's different things with different people. Is it that you have a lot of food pushers in your, around you, who will insist that you need to eat, 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 eat all the time? And for some people, that is their love language. So food is not a simple thing like, oh, just eat this and don't eat that, and that kind of stuff. So your relationship with food is something extremely important to know. And most of the time, I found that most people end up doing things they did not plan to do, eating things they did not intend to eat, because they haven't dealt with their relationship with food. And some of it can go back to your childhood as well. If you've had a very difficult childhood, maybe that is the reason you have this, unhelpful relationship with food. So obviously, unless you've dealt with that, this is not going to be a long-term solution, right? What is the next thing? And I'm going to pause there in case any of you have questions, because I'm going to drink some water before I move on to the next challenge that you might have in making lifestyle changes. And feel free to type your question in either the Q&A box or even in the chat box. And you can keep your questions for the end as well. So I'm going to move on to the next one. This is huge, and this applies to me as well. So, like I talked earlier about weight loss in PCOS, you can lose weight on any diet, and I'm sure many of you have had that experience. And you may not even have PCOS, but you did try to lose weight, and you got onto this wonderful diet, and you got these drinks, and you got these low calorie meal replacements, and you lost a lot of weight, or you got onto medications. But once you got off the program, what happened? Because you did not plan for that phase. Now, studies have shown, like I said earlier, the weight loss maintenance challenge is not something we have solved for yet, because number one, weight loss is, and I'm sure all of you know this, but I'm still going to state it again in case, just to be aware. Weight loss is not a simple problem of, eating less and moving more. Like you eat a low calorie diet, or maybe you ate an extra sweet one day and you decide, okay, I'm going to spend half an hour on the treadmill because you found out in exact calculations that one, whatever it was, one cookie is equal to 13 minutes on the treadmill. No, our bodies don't work like that. So the brain has a huge impact on our weight, and a lot of things that change in our metabolism and our hormones and our gut hormones and the gut microbiome. So in the maintenance phase, studies have shown that those who were able to successfully maintain the weight loss, so they 5 years, 6 years down the line, what did they do differently? One of the things is they did a lot more exercise. So in the living with PCOS, the tiny habits way, my goal is to help you create an exercise habit. I know the word exercise may not be very exciting for many of you. I'm someone who doesn't love exercise, whereas I meet a lot of people who, like, for them exercise is like a habit forming drug, and they can't function if they don't exercise, if they don't work out every day. I am not talking about those people. I'm talking about people who are more, you exercise because you want some kind of an outcome. So maintaining weight loss, one of the things that is very important is for you to build muscle. And building muscle, the other important factor is adding more protein. So in this obstacle number 4, I'm going to talk about that as well. So if you fail to create a maintenance plan for those times when motivation is low, then obviously that is going to be an obstacle for you. And that is where the tiny habits method comes in. Tiny habits method is designed for those times when you don't have the motivation to do difficult things. As my fellow tiny habits coach and Jeff says, when the alternative is 0, that is when you plan to tiny habits method comes in your way. So you don't go to 0, but you may not end up doing something great that day, but you still feel good about it. So I can see a few questions. I'm going to go to the questions. Okay. Okay, thank you, Eve. I know you are always the the research geek. So, Neelam, I am not sure if I have PCOS. My sonography reports are normal. Hormone profile is normal, but I have acne, hair fall, unwanted hair on chin and breast. Weight is under control, 34 years old. So can you tell me if it is PCOS or not? So truthfully, Neelam, I won't be able to give you that answer because I'm not seeing you as a doctor. So that is a doctor-patient question. And I do hope you can talk to your doctor and find out if you have insulin resistance. Because insulin resistance, again, how will you suspect insulin resistance? You may not have PCOS at all, but still have insulin resistance. If you have problem with belly fat, you have excessive belly fat, you have trouble losing weight, You have all these issues you mentioned. Hair fall could also be from nutrient deficiencies. If you're deficient in iron, B vitamins, vitamin D, whole bunch of stuff. Hair fall could be many different reasons, but nutrient deficiencies are one of the commonest ones. And nutrient deficiencies are present in most people, even if you eat super healthy, because of the way food is grown now, and also because of the quantity of food we can eat. And some of us eat some things, we don't eat a whole bunch of other things. So it's absolutely impossible, and this sounds rather radical, but it is impossible for anyone to get all the nutrients from only food, however healthy you might eat. So I'm just keeping a tab on the time. So that is okay. This is again big, and this was something I got to know when I got trained as a Tiny Habits coach. Choosing the wrong behavior, or choosing the wrong outcome, I would say. So let us say, you are living with obesity, but at the same time, you also have anxiety, you have depression, you have excessive hair growth, and you just don't feel well. But your friend, or maybe very well-meaning family members, I have a lot of young girls whose parents are like after their life sometimes, and very often I've told them, please get your parents on the consult, because they need to know what I'm telling you, because you can't always translate what I'm telling you to them later on. They need to get off your case, so to say. So for some of you, I will say that improving your mood is much more important than starting on an exercise program right away. Now, again, there is no one, way for each and every one of you. Yes, exercise can help with your mood, but if you have, let us say, iron deficiency, I keep on picking on iron deficiency because it is so common. Iron deficiency, you're not on multiple nutrients, you have a B vitamin deficiency, you have, thyroid dysfunction. Obviously, your energy levels are not high enough for you to go to the gym, but you've decided, because everyone's told you you need to go to the gym, you don't want to go to the gym, or you go to the gym and you sort of, barrel through it because of your motivation and will force. But what happens when both of those are not, reliable? Because that motivation and will force is a really blunt tool. And we've been using motivation and will force for all these years in trying to get people to change their habits. So make sure that you choose the right outcome. If you are feeling, you don't have enough energy, you're fatigued, middle of the day, you are like, you feel like taking a nap, then maybe signing up for the gym is not a great idea. You need to start off with nutritional supplements first. And I know many of you will be shocked that I'm saying start off with supplements first, but I have recommended this to a lot of my patients. Once you start on high dose, therapeutic dose multi-nutrients, what you end up doing is you feel better. And once you feel better, you're in a better state to do more difficult things, like, if you are not someone who loves exercise, or making, food changes. For food changes, for some of you, that is probably one of the most difficult things you will deal with. If you have a food addiction, then obviously, making that decision to go and talk to a specialist who knows what to do with the food addiction. Food addiction, see, the problem with food addiction is we cannot live without food, unlike alcohol or any of the other habit forming substances. We can happily live without them, but we cannot live without food. And you can't do moderation. You can't eat one cookie, because that is the problem in food addiction. You cannot just stop with one. I know I'm sounding like the ad of one particular this thing I don't want to mention, but it's not a personal shortcoming that you end up finishing the sorry, the whole bag of chips, or the whole bag of cookies, or whatever it is, or the whole tub of ice cream. It's not a personal shortcoming. It's a problem which needs a different solution. So that is what I want to stress upon. So then the next thing is, This is big. And again, this was not something I was doing earlier. I was, okay, if you're eating a lot of sugary food, you need to stop all that cold turkey. Don't even use, non-sugar sweeteners to help you overcome that habit. If you can, use it for a short term. But we know that non-sugar sweeteners are extremely harmful to your gut microbiome, and they don't result in weight loss. But before you address a habit that is not helping you, how about you add a new habit that is more helpful? So I start with, how about you add more protein to your food before you think of, eliminating all the other things. So what do I mean by adding more protein? Number one, most people in the world, and I know because I struggle with it as well, do not eat enough protein. So why is protein beneficial? Number one, protein, and particularly since in PCOS we talk about insulin resistance, proteins do not raise your blood glucose and insulin levels as much as carbohydrates do. And protein and good quality fat also keep you satiated long term. So you're not going to start feeling hungry very soon if you eat adequate protein. So in the PCOS Clarity, the free course, you will find my associate Mikhal has a lovely video where we talk about planning your plate. So serve yourself protein first. So whichever is your favorite protein, it could be fish, meat, eggs, or if you're vegetarian, maybe tofu or cottage cheese. You serve yourself protein first, then serve yourself some non-starchy vegetables, which is cooked in maybe olive oil or ghee or butter. Then there's very little space left to add any carbohydrates. And the other thing you'll realize, and this is not just me talking theory, I've experienced it myself, and I'm sure many of you have experienced it as well. When you start your meal with the protein first, you realize that very often you don't eat as much as you would have otherwise eaten. And if you use a continuous blood glucose monitor, CGM, I'm not talking about CGM today, you will see it. I recently put on a CGM again because I ended up gaining some belly fat, and I was just blaming it on my husband not being here. So it's all my loneliness getting stuck to my belly. But my metabolic flexibility has taken a wrong turn. So I'm getting back. Again, exercise is a big one. So if you use one of those continuous glucose monitors, or you check your blood glucose levels after your meal with the finger stick, you will find that eating protein first versus eating carbohydrates first gives you a very different blood glucose response. So blood glucose levels will not go up as much if you eat protein first. So prioritize protein. If there's one thing you want to go away from this webinar today, prioritize eating protein and start an exercise habit. It doesn't have to be something dramatic. It could just be a 5-minute walk after every meal. So that is where, the different strategies, see what you're going to do long term. Food is so big. The fact is, we eat different food based on where we grew up, what culturally was appropriate for us. Then now for me, it's more of convenience. So I'm originally from India, and if you know what Indian food, those are very labor intensive. So I decided and many of them are very high in carbs. So I'm not going to eat that. It's much easier for me to, use the air fryer or the pressure cooker or bake, because they don't need constant tending. So these are the reasons why our food changes. So what are you going to eat long term? I have had many patients tell me, doctor, I got on the ketogenic diet, but I'm so sick of having only chicken all the time. So obviously, that is not going to completely work for you. So we have a question. PCOS causes ovarian cancer coupled with obesity? Not really. Plastics, yes, okay, there are lots of things. Anyway, you did not give us your name. You posted an anonymous question. No, you are not a geek. So plastics in the environment is a very important factor. I mean, you are a geek, but a good geek. Sorry, it came out so wrong. So yes, it is very true, but I'm not sure it causes ovarian cancer. I'm not familiar with that, but yes, obesity is related to all cancers. And for ovarian cancer, I'm not sure we yet know the specific causes. And so, yeah, you're a food technologist and you can contribute to a PCO-centric organization. Thank you very much. So when you talk about, hormone disrupting chemicals and plastics, yes, you are right. And in my course, PCOS Clarity, I do have this thing about EDCs. So these are endocrine disrupting chemicals. Yes, and they are everywhere. And it's not an easy job. Just I think last week I was talking about toxic chemicals and how to prevent or reduce your exposure. I was talking about brain health. So I have another series of webinars where I talk about the brain. So yes, you're right. There are a whole bunch of toxic chemicals, but PCOS and ovarian cancer, I'm not so familiar with that connection, but that is something definitely important to keep in mind. Now, I'm just looking at the time. It's just a little more than half an hour gone. I'm going to stop sharing this. And so just give me a little time to move my way around, the different tabs that I have open. So the next thing is going to be, where is my browser? Okay. So I am going to launch my course. Okay, yes, yes, we don't need to take the entire world to heal the mess, one person at a time. Definitely, for sure. Okay. So I know many of you in the audience today, you actually did go through my last PCOS course, which was a free course. It was an email course. So every day, or I think it was every 24 or 48 hours, you received an email with some information and some action steps. This is an edited version because there was no food addiction in that one, and I didn't talk about a lot of other things. Few things I've changed around in that. And that is, this course is still a work in progress. You will see that some of them I have not added yet. One of them is weight loss and PCOS. So I will send, of course, I'll send the link to you to this course. And you can see that you will have to sign up. Now, I tried very hard to make it into a very simple sign up form, just your name and email, but I am sorry. I'm not a developer. I don't have WordPress, I don't know coding. So I'm trying to find someone who will make it simple, but until then, my apologies. So you will have to fill up I think it asks for name, email. I don't know whether it's asked for date of birth, but gender and a whole lot of more information, which I don't need, but I don't have the ability to change that now. So apologizing ahead of time. So here it is. There are 17 or 18 different lessons. And definitely, I would love to know from you all, your feedback on what you found helpful, what was not helpful, what was like, this is absolutely useless, So I would like to do that. I'd like your feedback on this. And again, some of you might find the order confusing. And this is the reason I'm very happy to move from an email to a course on my website, because you have the option of starting wherever you want to start. You don't have to necessarily follow the email sequence that I had created back then. So you can see all the stuff that I'm talking about about PCOS. What are the best exercises? How can you lose weight? PCOS and hypothyroidism are very often present together. And that is, again, the common connection is through the liver. How does sleep affect you? Do you prioritize sleep, or do you have chronic insomnia? All those things. And how can you get your stress to work? Do you need antidepressant medications? Are your birth control pills getting in the way of your mood? Plastic bottle, we talked about EDCs just now. So then nutritional deficiencies, and as you can see, there are a whole bunch numbers to know. What are the BMI is not the best measure of health. So that is where I'm going to add to PCOS weight loss, which supplements may be helpful for you. So bottom line is there is a lot of information in this course, which is free. You just need to sign up, and you can, and of course, remember your login information. You can see this is free, and I don't know whether the buy now, book now, in case something doesn't work, just reach out to me. My clinic email is info at drkarmd.com. So just reach out to me on an email, and me and my office will try to solve the problem for you in case you have problem logging in or anything. Hopefully soon I'll be able to have it on a different platform, and make it much easier for you to access it. But right now, yeah, you don't need to sign up with quite a lot of information. So this is PCOS Clarity, a lifestyle approach, and I am planning to keep adding stuff to this. But again, as information alone is not going to make a big difference to you unless you act on that information. And that is the missing piece, which as a Tiny Habits coach, I realized that is where I can help you much better now. So I'm going to stop sharing this. And if you don't have any more questions, I'm going to talk about the program that I'm so excited to launch today. That program is going to start in June, not now. Would any of you like to share any insight, like, oh, this was something I didn't know, and I'm going to implement something based on that information? Please feel free to share. If you want to share, post as an anonymous on the Q&A box, feel free to do that. If you want to share in the chat box, feel free to do that as well. But I think the chat box doesn't, chats don't go to everyone. It's only to me as the host. Okay. So now I'm going to go on changing gears and talk about the course that I'm so excited to launch. So just bear with me until I get my bearings. I'm like thinking around with 3 tabs and a PowerPoint's, where am I? Okay, here. So this is the course, and as you can see, normally it's like $497. If any of you have done any of my previous courses, you know that we used to have about 8 weeks of weekly webinars and a whole lot of information sharing at every webinar, which I am going to put into the free course so that you can go through the information part of the course on your own. So living with PCOS the Tiny Habits way. What is different about the Tiny Habits way? I talked about, do you plan for the time when motivation is not high? So the Tiny Habits method is based on the research of Dr. BJ Fogg, who is the head of the behavior design lab at Stanford. And based on his research, he has helped thousands of people change their behavior. He talks about this information action fallacy. We give more information and more information and more information to you until you're sick and tired of all the information, but you've not taken any action. So we assume that if we give more information, you'll end up taking more action, but it doesn't work that way. So the Tiny Habits method it works not because it is tiny, but because of your emotions. And none of this will make sense unless you read the book or been a part of a Tiny Habits program. Definitely you will understand once you join the program, and I'm going to go through the Tiny Habits method. So what is included in the program? One is you get a one-on-one Zoom call with me to decide, what your strategies and your goals are and what would be the best method for you. Then you get a copy of the actual physical book. Now, here is where I know I can deliver to the US, to Canada, and India, because I have sent books to other people from Amazon through that. But if you are in a country where I'm not sure, obviously feel free to reach out, and I'm going to make sure that either I give you a refund of the price of the book so that you can buy it locally, or you can, I'll figure out something for you, but you need the book to be a part of the course, because I'm going to talk about, I'm going to go through the book and all the strategies mentioned there. Now, I have planned for 2 webinars right now because I wanted to keep the cost low, but it's not like if I find that all of you need more, support, I'm definitely willing to, have schedule more webinars, because my goal is to actually help you make lasting change and not just, just create one more program. Then you, of course, get free access to the PCOS Clarity. And this was 17 lessons. Now it has become 18. Maybe it's going to become 20 eventually. I don't know. There'll be new courses added. And if you access that once, you'll have access to all of them. So you can feel free to, if you want to book right away, I will share the link, payment link. So what are people saying? I'm going to leave that on the screen for a minute while I find the payment link. Oh, I can't find that link now. So let me open this and see what happens. Okay, yeah, I got the payment link. So I'm going to post the payment link in the chat box in case you want to use it right away. You can click on that and that'll take you to the payment link in case you want to book right away. And where am I? Okay, any more questions? So this is back to the tiny habits, living with PCOS, the tiny habits way. And I do post on Instagram on PCOS. I've started fairly recently. So I do have a few posts, which I hope you'll find helpful. So follow me on Instagram. It's again, instagram.com/Dr. Kaur MD. And feel free to post your questions there, or feel free to reach out to me by email. And I don't see any more questions. I had kept enough time for questions today, so we're actually finishing earlier than I had scheduled. And you will receive a recording. You'll receive a link to the free course, PCOS Clarity. You will receive a link to the paid program as well. I'm going to start this in June. I don't have a date yet, but I will start. I'm just waiting for a few tech stuff to get settled because I want you to have a good experience. And thank you for joining me. Bye now.